Excess deaths are up across the world, especially in vicinities that have high levels of jabs. We have higher numbers of younger people who are sick and out of work. Countries are struggling financially after the pandemic. And this is now the time that they are thinking about bringing in assisted dying laws. This is what's happening in the UK. It's already in place in Canada. And I just think this is the wrong timing. And there's a reason why I'm saying that. And it's largely because I can see what's going to happen next. Now, if anyone is not aware, I've been following autoimmunity from the beginning of the pandemic in terms of the cytokine storm in relation to the spike protein, and then what happens beyond with regards to immune priming from spike protein, any source, and what is happening with ongoing circulation of the virus with spike protein plus immune priming. The combination is an absolute disaster. Now, what does it mean for people's health going forward? Based on everything around the science, people are going to get sicker. And as people get sicker, these decisions suddenly start to take on a different appearance. This is why, in my opinion, timing is wrong. This is a big problem. So I'm going to share with you a bit of information. This is from the BBC. And so I think that it's useful to see what the issues are in terms of the UK. So at the moment here, this is in the BBC News, and this was the hardest decision of my career. MPs wrestle with the assisted dying choice because it's not yet a decision. It has to go through Parliament. And so this is the 26th of November 2024. And tomorrow, on Friday, MPs will make one of their most profound decisions: how to vote on the assisted dying bill. I'll go through some details about the bill quite shortly, but in reality, this is a big deal. Now, this is about the fourth time it has come in front of Parliament. This has been bounced back on a number of occasions because they didn't think society was ready for it. But now, post pandemic, they think that potentially we are. Now, just a warning here to clinical people: if you are listening, the responsibility will fall to you. So, even though politicians are making the decisions, it will be your responsibility to action these things. So, you better get your voice out there because it's relevant to you. So, the first thing that I think is very valuable to clarify is the difference with the concept of assisted dying versus euthanasia and so on. So, here is the explanation. This was from a related article. So, what is assisted dying versus assisted suicide versus euthanasia? So, assisted dying is for a person who is terminally ill, and they are then given lethal drugs from a medical practitioner, which they administer themselves. That's assisted dying. That's what they're debating in the UK. But not far behind it is assisted suicide. That's where you're intentionally helping someone else to end their life, including someone who is not terminally ill. And this is more likely to be what's happening in Canada with regards to the MAID program. Okay. And then you have euthanasia. That's the act of deliberately ending someone's life where the lethal drug is administered by the physician. So the doctor then gives the medication in the context of euthanasia. So those are the three types. And at the moment in the UK, they are debating about assisted dying. And I'll come to that in just a minute. Now, where is this done already? As I mentioned before, currently, Switzerland has assisted suicide since 1942. So you don't have to be terminally ill. That's dignitas. Then assisted suicide is also legal in Austria. And then in the USA, there are 11 states that allow physician assisted dying. That's a euthanasia. So they can prescribe, it permits doctors to prescribe the drugs for self administration. So this would be assisted suicide. Voluntary euthanasia is legal in Canada. That's where it's called medical assistance in dying. And so this is where the doctor or the nurse can prescribe the drugs for self administration. So, in theory, it's not directly euthanasia if the medication is not delivered by the clinician. And so, this is where the law is slightly different. It's also legal in Spain and Colombia. And so, what we can see is that this is a trend that is occurring across the world. And it's increasing because the truth is, from a clinical point of view, we very oftentimes come across patients who are really suffering, have a terminal illness, and it is terrible to watch them pass away. It's very difficult. And you can see in very specific clinical contexts that this could be of value in society. So it's not that I have taken a position that I am against it in principle. I just think the timing is wrong and the setup that they're doing is also a problem. And the fact that clinicians have largely been silent on this, I worry that they don't realize that this is falling in their laps. This is going to be their responsibility. So let's take a closer look. And one important thing in terms of what is going to happen in the future. Remember, I just did post-vax euthanasia. That's where in Canada they did euthanasia or assisted suicide on someone who had vaccine related complications. This was clearly documented. They were reviewing if it was the right thing to do, but it was the critical indication as what is coming. This is why I'm talking about it now, because I don't think people realize just how sick people are going to get. Now, it's especially important in the context of the elderly because they oftentimes get sick and you have no idea what it is that's making them so sick. And so, very often, they are extremely vulnerable to the impact of these kinds of bills. Additionally, and this is the really critical piece of the puzzle, if there is no money to take care of the frail, older people who don't have support at home from family and so on, and there is no money in the kitty, very easily it will become practical to help this process along. And when we think about COVID, as I said, remember, we've just had a super spreading event occurring in the summer across the Western Hemisphere. What it means is that within 3 to 6 months of it, you start to have people getting sick with all kinds of strange things. And because people are not up to date with understanding the autoimmune process and understanding the impact of spike protein, these people just look sick and they just keep on struggling. And then that's where the problem lies. So when we look in detail at the bill, and I'm going to show you here the bill, there are a number of things that I think are very worrying. So this is the terminally ill adults end of life bill. Okay. And so this is what it looks like. I can't remember how many pages it is. It's easy to get if you wanted to look at it. And so the first thing is that they have said allow adults who are terminally ill. Okay. They mentioned it's assisted dying. The person has to have capacity. They have to be over 18. They have to be a resident in the UK. And they have to have a general medical practitioner. Here is the first problem. What is terminal illness? If the person has an inevitably progressive illness, disease, or medical condition which cannot be reversed by treatment, and the person's death is going to be a consequence of that illness and is reasonably expected within 6 months. This is complex. We see a lot of people who could fall into that kind of category. If they have cancer and they have got metastatic cancer, that's different. That's pretty straightforward in understanding terminal illness. But when people don't have a specific condition, and you can look at them and know that they're very frail, and you can reasonably predict. I think the way that oftentimes, from a clinical point of view, the conversation is very simple. If you look at the patient, and if someone said to you in 6 months' time that that person wasn't here, would you be surprised? And if your response is no, I wouldn't be surprised. In effect, that person is in the terminal phase of life, but it doesn't mean that they have a terminal condition. And very often, even though you may predict that in a vast majority of patients and be right, there are a number of them who will be there in 3 years' time still looking the same. So it's not actually a science to predict it. And so this bit in terms of timing is very, very concerning. And as I said, the clinical community will be pressured to make these decisions. Next, what it goes on to is that they have an initial discussion with their registered medical practitioner. This is probably their GP. So, this person is then going to have the discussion with the person who wants to die, is suffering with maybe a terminal condition, and they wish to have this done. They have the capacity, and it's clear that they have a diagnosis. Now, what then happens is that they then get referred after this person agrees to it. The first person, as I said, remember this from the clinical point of view, it's doctors who have to do that referral. And this is what I'm saying is that the clinical community doesn't realize that this bill, if it passes on Friday, is going to drop in their laps. This is going to be your call. And so you better have an opinion on this. And you better know that once it's passed, if it's passed, it's going to start happening relatively quickly, that these things are going to happen. So once the first doctor has done that assessment, and you have it here, the coordinating doctor must do a first declaration. And once that is done, then they have another independent doctor who must carry out the second assessment of the person. And this is kind of following how we do death certificates at the moment. And so, meaning that if a patient dies, the doctor who knows the most about the patient will fill in the death certificate. It then has to be reviewed by an independent doctor who then signs off on the cause of death. And that was brought in after Shipman was found to be killing a lot of patients. And so this was a protection so that you couldn't have that occurring. And so this is a real practical thing that they're doing that is already done in terms of death certificates. But in the context of assisted dying, I think this is far more complex. Years ago, I'd never spoken about it, but because I knew this day was coming, I actually pulled together a whole article looking at this and saying how you protect the doctors is you don't let them make that second decision. That second decision, in my view, should not be done by an independent doctor. It should be done by a bulked up and strengthened palliative care team. Now, the palliative care team may not like this in the UK, but in the UK, they are the best at being able to help patients through the terminal phase of illness. So, in my view, a bulked up palliative care team where they do all the assessments, they do everything to look at the person's state of mind, they try and intervene to support them and deal with the issues. And if at the end of that, they then determine as a multidisciplinary team that this is the best thing to do, that's different. I don't think it should be an individual second doctor. That's just my opinion. And I think that there are the resources and the system already in place to make it safer, because invariably this is coming. But as I said, when you add the complications of COVID spike protein autoimmunity, goodness gracious, The kinds of illness that we are going to see in the next few years will boggle our minds. And this is just an extrapolation of autoimmunity. Because once you have the immune system targeting different organs, because this is the problem with autoimmunity, you can't predict which organ it's going to target. For some people, it will be the heart, so they'll present with heart failure. For others, it will be the kidney, they'll have kidney failure. For other people, it will be the brain, they'll present with dementia. If it's the gut, they'll present with inflammatory bowel disease. And we're just going to see numbers rising and rising. And the worst part is, if the scientific community doesn't get their head around this very quickly, they will have no treatment. That's why the timing is wrong. Because based on my extrapolation, as I look forward for the next few years, it's just a matter of time, based on an autoimmune paradigm, that this explodes. It has to. So many people are being exposed to a spike protein that triggers autoimmune responses. In the predisposed, they are going to have accelerated autoimmune diseases. That's just the science extrapolation. So someone could argue and say, well, I disagree with you. That's fine. I'm just extrapolating the science to say what I think will occur within the next few years if you allow autoimmune responses to run rampant, which is what is happening at the moment. So when we combine the things, the assisted dying bill, with people who are terminally ill for which there is no clear cause, they are just sick and they're not getting better. That is the perfect description at the moment we have for severe long COVID type symptoms. Nobody quite understands what's going on with them. They can't find anything specific. They're getting more and more unwell. And then those ones, at least they know that's their condition. But then there's a whole cohort of people who are having spike protein complications from different sources. I can't say based on the elephant in the room. And they have no idea that that's the cause. And so we have this huge mountain of illness coming at a time when there is a bill and there is no money to take care of them. Already governments are struggling. They are trying to force people back into work because they're not working. They can't understand why. They've been to their doctors. Nobody knows what's wrong with them. They're saying, well, it's in your head. Time to get back to work. They don't understand the disease. They don't understand the complications. They don't understand autoimmunity. They will drive these people down a route where they will prefer to die than to continue to live. Science and medicine has to do better. And the problem is that if you give a way out other than doing the hard work, the research, doing all of the trials with medication to make sure you've done everything you can to protect lives and to make people better, the easy route will be to help them to get out of the picture. The COVID complications are breaking the system already, and it will continue to rise if the elephant in the room continues to be ignored. And just in case nobody has come across what I talk about with regards to the elephant in the room, this is what it looks like. The chairs are being knocked over, windows are being damaged. Nobody quite understands what's going on, but there is this huge elephant there that nobody wants to acknowledge, nobody wants to address, and they would rather to throw the chairs out of the window than address the elephant in the room. That's the reality of where we are today. So, if any of the MPs are listening, all I would say to them is this: when you are thinking about putting this into law, remember that we are at a phase where we don't fully understand all of the illness that is happening across the country. And you are opening a door that will eventually be used to get rid of the problem. That's just the reality. For clinical people, just to remind you, you are going to be the first or the second doctors. Are you happy with that? Are you ready for that? Because it will become your responsibility. My view is that this should be done through a palliative system if it is brought into being. I still think this is the wrong time, but if it does come, it shouldn't be a second independent doctor. It should be the palliative care team that has been resourced properly to be able to deal with these issues. But that's just my opinion. I am just one voice, but what we have in front of us is a combination of things that is going to be horrific if we don't do something about it in the near future. As a final point, just remember, I'd like you to make sure you join us in this journey. We want to make this number one. Are you prepared against disease X? And if you don't know what I mean, disease X is already happening. It's just that they don't want to call it that. A fascinating book, and you can get a preview of it here, and you can sign up for the pre-order wait list with regards to Amazon. We're very excited to bring this to you, and we hope you will enjoy it as much as we enjoyed putting it together. So thank you very much. Have a great evening. Serious times ahead. Let's hope we have wise leadership that will be able to guide us through it.